If you have been in a calorie deficit for more than 12 weeks, if your body fat is below 6%, if you are prepping for a show, a shoot, or a wedding in the next 4 weeks, there is a 7-stage ladder underneath your heart and you cannot feel it. Most cutters walk away clean from stage 6. Stage 7 is different. Stage 7 is the meal that ends the cut. This is what extreme dieting does to your heart, stage by stage. The first 6 stages are invisible. Stage 7 is where the heart does not come back. Stage 1. Leptin collapse. Leptin is a hormone made by your fat cells. Its only job is to tell your brain that you are not starving. When your body fat falls below 6% in men or 12% in women, your leptin drops below 2 nanograms per milliliter. That number is the famine signal. Your hypothalamus reads that number and treats you as if you were dying. It begins to dismantle every system the body considers optional. Your heart is on that list. Stage 2. The axis shutdown. Your hypothalamus stops sending pulses to your pituitary. Your pituitary stops talking to your gonads, your thyroid, and your adrenal glands. Testosterone halves in men, estrogen tanks in women. Active thyroid hormone, T3, drops 30 to 40%. Your resting metabolic rate falls a quarter below baseline. Your sympathetic nervous system retreats. Adrenaline tone fades. The chemical signal that tells your heart to beat hard is no longer arriving. The heart begins to coast. Stage 3. Bradycardia. Your resting heart rate drops below 50 beats per minute. In extreme cases, below 40. In published case reports, contest prep athletes have recorded 32 beats per minute at rest. On a routine physical, that number looks athletic. Your doctor congratulates you. They say it is the heart of a marathon runner. They are wrong. A marathon runner has a thick, powerful left ventricle that fills slowly because it can. Your left ventricle is slow because it is already thinning. Stage 4 is where it shows up. Stage 4. Cardiac atrophy. Your heart muscle is being broken down for fuel like any other tissue in your body. The left ventricle wall thins. Stroke volume falls. Echocardiograms of chronically restricting athletes show left ventricular mass losses of 10 to 30%. A scan would catch this in 2 minutes. Almost no cutter ever gets one. Caught here, the heart regrows. Caught later, some of the muscle is gone for good. The window closes quietly. Stage 5. Electrolyte drift. Potassium slides, magnesium slides, phosphate slides. Each one drops from your blood faster than your kidneys can replace it. The electrical timing inside your heart begins to stretch. A measurement called the QT interval creeps past 450 milliseconds, then past 460. Above 500 milliseconds, the risk of a fatal rhythm called torsade de pointes climbs sharply. You feel nothing. The damage is still perfectly silent. Stage 6. Subclinical arrhythmia. The first ectopic beats arrive. A flutter walking up the stairs. A skipped beat during posing practice. A lightheadedness you blame on the diet. A Holter monitor would record dozens of premature ventricular contractions per hour. Studies of physique competitors find roughly 30% show abnormal ECG readings during peak week. Almost none of them are referred to a cardiologist. The flutter gets blamed on caffeine, on stress, on pre-workout. The cut continues. The show happens. The damage is locked in. Stage 7. The refeeding event. The cut is over. The show is done. The shoot is wrapped. The first real meal arrives at the table. Insulin spikes for the first time in months. Phosphate, potassium, and magnesium that have been drifting in your bloodstream rush into the cells all at once. Within hours, serum phosphate can fall below 0.3 millimoles per liter. That is the documented killer threshold. The thinned ventricle, the stretched QT, the electrolyte vacuum, the silent ectopic rhythm. All 4 converge in the same hour. The heart fibrillates, often at rest, often during sleep. Most refeeding syndrome deaths happen in the first 72 hours after the cut ends. The cut did the damage. The meal pulled the trigger. There is no symptom at stage 3. There is no warning at stage 5. There is no coming back from the meal at stage 7. If you have been in a deficit longer than 12 weeks, do 3 things today before your next meal. Get a resting ECG. Get a serum panel for phosphate, potassium, and magnesium. Get an echocardiogram. When the cut ends, do not eat at maintenance. Do not eat at surplus. Eat 100 calories above maintenance for the first 3 days. This is the same protocol hospitals use to refeed starvation patients without killing them. Send this to anyone in your gym prepping for a show. The next video goes inside a different organ that also forgets how to come back.